Hi, my name's Emily. I'm going to be the nurse practitioner doing your ears, nose, and throat exam today. Can you please tell me your full name and date of birth?
Zach Seach, and I was born on December 23rd, 1993.
Okay. So we're going to start our exam by doing a skin exam. I will start at the scalp and the head, and in a clinical setting, I would work my way down the patient's body. But since we are not in a clinical setting, I will note the face has freckles, facial hair. His skin is smooth of texture. It is dry and it is cool to touch. Do you have any family history of skin issues?
My one grandmother had to have a few skin cancers removed.
Okay.
That's
Do you do checks on your skin to make sure you don't have abnormal moles or anything like that?
I do
Okay, that might be something you want to start doing since you do have a family history of that. Any specific skincare routine you go through?
not. No, just the basics.
Okay. Do you have any current lesions or any history of lesions on your skin?
I do not.
Okay. So now we will assess the patient's skin turgor. First, I will do it over the clavicle. I will pinch the skin between my fingers, and I note that it rebounds quickly, so he has good elasticity and skin turgor there. And I will also assess on the patient's hand. Again, it rebounds quickly, so good turgor and elasticity there. Next, we will assess the hair. I note that the hair is evenly distributed throughout the scalp with no missing patches or irregularities. It is brown in color and it is soft to touch. We'll go to the patient's nails. If you could set your nails up here, please. The pigmentation of the nails is normal. They are short in length. They are symmetrical on both hands. The nails are they are hard with no masses or irregularities. And I will check for nail bed adherence by pinching the nails between my fingers and noting that there is no lifting of the nails when doing so. I will also note during this time that the capillary refill is less than 3 seconds. I will have the patient place his hands like this to check for clubbing, and I will note that there is no diamond made with his fingernails during that exam. Okay, good. We'll now move to the eye portion of the exam. I will note that the patient's eyes are symmetrical on both sides of his head. There's no swelling in the orbital area or eyelids. The patient has no abnormal eyelid drooping, so no ptosis is noted. I will assess the sclera and the conjunctiva by pulling the bottom eyelid down, having the patient look up, and noting that it is white and vascular with no foreign objects or redness. I will also check by having the patient close his eyes and depressing slightly, and the eyes can push back without difficulty. So no obstructions are noted. I will check the patient's visual acuity now. We do this by doing a Snellen test. Please stand. Okay, go ahead and cover your left eye, and we will read down this list.
ELTFPH,
Very good. And then cover your opposite eye, please.
ELTFPH, OLCFDHJBS, EPTZO, CFDHJ, LTFPH.
Good. And I will note that the patient has 20/20 vision in both of his eyes per the Snellen chart. Now we will check the visual fields. I'll start by the confrontation testing. So I will begin posterior to the patient and wiggle my fingers forward and have him tell me when he can see them. You can just say now.
Now. Now.
Very good. Again, we're going to check the visual fields. by checking the 6 cardinal views of gaze. So just follow my finger. And follow it to your nose, please. Very good. Again, no puffiness or edema in the orbital areas, no ptosis, tremors of the eyelids, or redness or swelling. I will note that the irises are brown. The pupils are both round, equal, and about a 4 in size. I will check the pupils for reaction to light, so look straight ahead of me. Reactive. Reactive. Very good. I'm going to palpate the lacrimal glands by starting at the inner canthus and moving outwards, noting no tenderness or swelling there. Now we will do our ophthalmoscope. Just look straight ahead at me, please. I am noting that the patient has reflection of light equal on both sides of the eye. I'm going to come closer to the patient, assess his eyes. I'm following the vasculature to the optic disc. Okay. That's all for our eye exam, and now we move to our ear exam. Again, I'm noting symmetry. I'm noting no color changes, redness, swelling. I'll do a tug test on the pinna and have the patient tell me if there's any pain. Any pain?
No.
So no infection or anything indicated with that. I will note that the patient has nodules on his earlobes. Have these been present forever?
Yes.
They've been present for his entire life. And now we will assess his auditory canals. Please tilt your head to the opposite shoulder. And I'm pulling up and back on the pinna. Okay, and I am noting the landmark structures in the ear, the handle of malleus, the reflection of light on the eardrum, and the omnia. And again, noting those landmark structures. I'm also noting that in the auditory canal, there's no foreign substances, redness, swelling, or drainage. I'm assessing his nose now. His nose is symmetrical on both sides. No swelling or tenderness. I'm palpating for bony or cartilage abnormalities, and none are noted. Any pain?
No.
No pain, drainage, or swelling on the nose. So we will now check the nose, the nares for patency. Okay. The membranes are pink, not swollen, no foreign objects. And I'm noting that just the inner and middle turbinate are visible. Excellent. I'm going to palpate the frontal sinuses for any tenderness. And I'm also going to palpate the mastoid for any tenderness. And there's no tenderness noted. Can you please open your jaw? Now I am assessing the temporomandibular joint, or the TMJ. Go ahead and close. For any crepitus, and none is noted there. There's no septal deviation noted in the nose. We're going to move to the patient's mouth and lips. I note that the patient's lips are symmetrical on both sides, no swelling or redness. They're not chapped or cracked. Can you please clench your teeth and smile wide? The patient does not have any missing or loose teeth. The teeth are clean and white and symmetrical. I'm going to assess the patient's buccal mucosa and gingiva for color, tenderness, and redness. Okay, just open wide. And I'm checking all the mucous membranes are pink, moist, Stick your tongue out. Say ah. The
The
uvula is medial. Tonsils are not swollen or red. Tongue up. All ducts are intact. No swelling under the tongue as well. Lastly, I will elicit a gag reflex. Very good. Moving back to the head and scalp, we will palpate the scalp, checking for any masses or tenderness, starting from front to back in a circular motion, and checking behind the ears. No mass is noted on the scalp, and it moves freely over the skull. Checking for faces. Patient has all normal facial structures. There's no abnormal facial expressions or tics noted. Again, we'll check the mastoid process for tenderness, but it is not tender. And we checked our TMJ already. The hair is brown, soft, and well distributed throughout the skull. Checking the neck. We're going to check the neck for fullness. There's no swelling noted, no webbing of the neck or abnormal skin folds. We can note, can you look at the camera please, that the patient's trachea is midline, and I will palpate the trachea, and it is midline. Go ahead and tilt your head up and swallow. Also palpating the hyoid bone. Okay, you can relax. There's no bumps or tenderness and no goiters noted of the thyroid gland. Lastly, we will palpate the lymph nodes. I will start with palpating the preauricular. I will move to the postauricular, then the occipital, the sternomastoid, the post-cervical, the supraclavicular, the anterior clavicle or cervical, submental, and submandibular. No swelling or tenderness of any lymph nodes is noted. Finally, we're going to auscultate. I will auscultate the patient for any temporal or thyroid bruits. Okay, normal pulses are noted and no bruits are present. Do you have any questions?
I do not.
That completes our ear, nose, and throat exam. Thank you.